My name is Dr. Amit Al-Habadia. I'm a consultant endocrinologist based at the Sheffield Teaching Hospitals in Sheffield. The thyroid gland is a very important gland which is located within the neck. It produces two main types of hormones. One is known as thyroxine or tetraiodothyronine, and the other one is known as triiodothyronine or T3. There are three main causes of an overactive thyroid gland within the United Kingdom. The most common condition by far is a disease known as Graves' disease, which accounts for about 3/4 of all cases of an overactive thyroid gland. Less commonly, patients may have a toxic multinodular goiter or a condition known as a toxic adenoma, in which they have a nodule within the thyroid gland that overproduces thyroid hormone. Hypothyroidism is a relatively common condition and amongst the most common of all endocrine conditions known. Overproduction of thyroid hormone makes patients feel generally quite unwell and leads to a number of symptoms. Probably the most common symptoms are weight loss, feeling tired. Very occasionally patients feel they have more energy, but it's more common to feel tired. Other common symptoms include having awareness of an increased heart rate or palpitations, feeling shaky, and disturbances of mood, particularly irritability or anxiety. Patients may also have more noticed difficulties with breathing, and ladies may have problems with menstruation, with periods often becoming less frequent or stopping altogether. Patients may also have bowel problems and find that they have to visit the toilet more frequently. The aim of treatment in most patients is to give a course of antithyroid drugs for a period of several months in order to try and induce a remission of the underlying problem that causes Graves' disease. Patients are started on antithyroid medication, and either that medication is titrated according to their blood tests, or they have one set dose given, and when thyroid hormone levels return to within the normal range, patients have thyroxine given in combination with their antithyroid medication. These two methods are known as either a titration method or a block and replace regimen. Most patients who are started on antithyroid medication tolerate the treatment well. They may occasionally get mild side effects such as a skin rash or joint aches and pains, which often subside spontaneously. The treatment is given for anywhere between 6 and 18 months, and at the end of the course of treatment, drugs are stopped, and it is seen at that point whether the Graves' disease has settled down and the overactive thyroid gland goes away. Once the course of antithyroid treatment is stopped, and if the patient's Graves' disease doesn't go into remission and the overactive thyroid returns once again, the main treatment options for curing the overactive thyroid gland are either to give a treatment known as radioiodine, which is given to try and destroy thyroid cells which overproduce thyroid hormone, or to perform an operation to remove the entire thyroid gland. The only common side effect of radioactive iodine treatment is the development of an underactive thyroid gland or hypothyroidism. This can be expected in about half of all patients 1 year after treatment, but there is the risk of developing hypothyroidism long term, and this can occur in 2 to 3% of patients every year after they have radioiodine treatment. Patients who have surgery for Graves' disease are usually treated with a near total thyroidectomy to remove most of the thyroid gland. Such patients will always require thyroxine treatment for the rest of their life after surgery to ensure that their thyroid function remains normal. In patients who have a multinodular goiter, again, like Graves' disease, they will usually have all of their thyroid gland removed. Patients who have a toxic adenoma due to a nodule which is producing too much thyroid hormone may be offered removal of part of their thyroid gland. In such cases, thyroid function may remain normal, or in the long term, some patients may become hypothyroid and require thyroxine treatment.